Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, now, after carcinoma esophagus, in the carcinoma esophagus, anastomotic leak after esophagectomy. So, in anastomotic leak, if there is anastomotic leak after esophagectomy, in carcinoma esophagus, so this anastomotic leak is the most common complication after esophagectomy, and it is higher in intracervical anastomosis than the intrathoracic anastomosis. This is higher following cervical anastomosis more commonly than the intrathoracic anastomosis, and it is rarely life-threatening condition. Most of the patients it resolves. Actually, whenever there is anastomotic leak around the following Ivor-Lewis operation, anastomotic leak following Ivor-Lewis operation is most commonly dangerous because this is associated with almost 50% of mortality rate. This is associated with 50% of mortality rate. So anastomotic leak after Ivor-Lewis operation or Ivor-Lewis esophagectomy is the dangerous complication. Then confirmation of the anastomotic leak can be done by a contrast study with the help of gastrographin swallow, or we can even introduce or instill the contrast through the nasogastric tube, either through a gastrographin swallow or by installation of contrast through the nasogastric tube. We can confirm the presence of anastomotic leak. Immediate intervention is required in this case. Immediate intervention is required where we do a direct repair is done by putting a muzzle flap. By putting a muzzle flap over the leaked portion. If this is the site where it is leaking, over this, if this is the portion where it is leaking, you put a muzzle flap over it like this. A muzzle flap is put, and then the rupture or the hole will be repaired, and you will have to do a wide drainage should also be done whenever it is necessary. Okay, next, this is done for the treatment of this anastomotic leak, right? But if the patient is stable, if the patient is okay, you can do this. But if the patient is unstable, or if the patient is severely ill, if the patient is unstable or if the patient is severely ill, in such cases, first and foremost, we will divert the leakage with a split fistula is done. Okay, you will divert the split fistula, and then you will use a conduit and close it later. Okay, you will close it later using a conduit. Next, pulmonary complications are the most common cause of post-operative morbidity and mortality if it is associated with transhiatal esophagectomy. In transhiatal esophagectomy, pulmonary complications are the most common cause of post-operative morbidity and mortality.
thank you and thank you for watching.